It seems nearly everything went virtual during the COVID lockdown, from schools to healthcare, and now some of that is in our new norm, specifically virtual healthcare. But going digital can still spook some folks. So joining me now to break it all down, we've got Dr. Troy Russell of Teladoc Health. Good morning to you, doctor. First off, how popular has telemedicine gotten in recent years?
A pleasure to be here. Thanks for having me. We've seen doubling from 2021 to 2022 of individuals seeking out a virtual primary care offering that we have at Teladoc Health. And we feel that this has gone mainstream, that people have seen its value, and we intend to expand access in Texas.
I want to pose something at you because back in December, I'm going to be so real. I remember feeling, okay, this is a little weird. I had symptoms of shingles. Within 1 hour, I scheduled my doctor visit, I had the visit, and I got the prescription for having shingles. And it was really, really critical. I had that within the first few days of getting diagnosed because then it lessened the illness. When would you recommend a Teladoc visit to someone as opposed to an in-person visit?
I think it's important to highlight that for many people, traditional primary care has ultimately failed them, that they have a symptom or complaint similar to what you just described, and getting access to a visit maybe 2, 3, 4 weeks out. And in your circumstance, as you just described, it's really important to get that taken care of right away. And so at Teladoc Health, access to a primary care doctor is within days and sometimes even within the same day. And we feel that that is really going to make the difference for people who are having symptoms, as well as addressing any chronic disease or preventative measures. And so instead of, I would say, flip the script a little bit, instead of thinking about the patient having to or you having to decide when to see your virtual primary care doctor, you actually can make that decision right away, see them, and they can help triage what is something appropriate to be addressed in a virtual space versus something that can be addressed, say, in urgent care or ER.
And I want to take for granted the fact that a lot of people these days have gone virtual with things. There are some older generations who still might have a little trouble. So what kind of questions do patients need to be prepared to ask and to answer?
I think it's really important to highlight the fact that virtual primary care visits are very similar. They mirror your traditional brick and mortar. The only real major differences, I would say, instead of doing your check-in process on a clipboard in the waiting room, you'd be able to do that online and be able to fill out that information in advance. Similarly, you would be doing a regular intake, collecting your weight, your blood pressure, other vital signs with the medical assistant, as well as communicate kind of your needs or questions you have to your virtual primary care doctor, as well as to the care team. I think it's similar to your traditional brick and mortar space, really important to highlight what it is you're interested in talking to your doctor about. Having that information in advance makes it a very efficient and effective visit, and that helps your team prepare for your visit. And I think second is something that I noticed with many of my patients in the virtual space, as well as when I've been in the traditional office space, is bringing in your medication list or pill bottles to make sure that similar to when you have needed to reconcile your medications in the face-to-face office, having that available during your virtual visit makes sure that the virtual primary care doctor has the same medication list and that it matches your own. That way we're working off of the same care. I think it's overall something that people, just as you mentioned, is surprisingly a great experience. Something that it's not uncommon for us to hear that people will say, this is the very best healthcare experience of my life. And I think that if anybody is exploring it, I encourage them to try it and see for themselves.
All right, Dr. Russell, appreciate it. Hopefully this can help, especially with folks that are looking to get in quickly and get that visit done. So appreciate it. Thank you so much.